Hi, I'm Joe DiMatteo of the Len and Joe Ask the Pharmacist radio broadcast. Thanks for tuning in with us again today. I have an interesting area that I'd like to talk to you about today. Premenstrual syndrome, premenstrual dysphoric disorder, PMDD, huge problem for a lot of women, young teens, late teens, early 20s, even into the 30s. A lot of issues surround this that are not as black and white many times as the medical community would make them out to be. And I'd like to cover a few of those with you today. What is premenstrual syndrome? Premenstrual syndrome is characterized by a number of issues. A lot of cramping, low cramping, breast tenderness, fluid retention, headaches, backaches, heavy menses, disrupted menses and bleeding, anxiety, nervousness, the list goes on. And I don't know, you may have 1, 2, 3, or all of what I mentioned plus. The traditional approaches to this right now, today, are to either use some form of oral contraceptive to lower estrogen production and lower testosterone production. Does it work? It works to a degree. Not completely, but to a degree. I think there are some issues with using oral contraceptives long term. It's a whole other subject. Maybe we can talk about in a later broadcast. Or the use of antidepressants, serotonin reuptake inhibitors. There are some medications along this line that have specific FDA approvals and indications. One is Serafin, which is fluoxetine, which is really Prozac, and you use it late in the month, 2 weeks prior or a week prior to 2 weeks prior to your menses, helping to raise serotonin. I believe that it's much more complicated than that, and that's kind of what I'd like to talk to you about today. So we talk about the mood, we talk about the anxiety. I'm going to classify these for you. There's PMS anxiety, which is typified many times by high estrogen, low progesterone levels, and possibly low magnesium status. Premenstrual cramping, PMSC we would term it, premenstrual cramping, which is usually typified by either high sodium intake, low magnesium. There's PMS depression, which is many times associated with low progesterone, high estrogen, and imbalance of the brain neurotransmitters, creating more depression. And that's kind of where maybe the Serafin and the utilization of medications like SSRIs would fit in. And then we also have PMS hyperhydration, which is many times a low magnesium, high estrogen, low progesterone, high sodium, high salt intake scenario. So those are the main areas. There's PMS anxiety, PMS cramping, PMS depression, PMS anxiety. So there's actually 4 different strata that you can break these out into. And they're not all interacted with specifically one particular area. As you can see, there's some other issues that are at work here. Sometimes it's higher testosterone and higher estrogen, or very low progesterone, nutrient deficits, etc. So what I'd like to do now is to talk to you about how we, as naturopaths, as clinical nutritionists, and as pharmacists, because Len and I both are doctors in naturopathy, board certified in clinical nutrition, and pharmacists, so we can understand and relate to the pharmacology, the pharmaceutical side of this, as well as what's going on in the dynamics of your body and where we've gone astray. Why do some women suffer with more premenstrual type issues than others? I'm not real sure. I'm not real sure where we get off path completely every single time, but I'll attempt to define some of these areas for you. I think the first thing to do is to do a saliva hormone panel. A lot of folks don't understand saliva hormone testing, and I'm going to give you the quick and the skinny on this. Saliva hormones actually give you the free fraction of the hormone that is available. So what makes its way into your saliva is actually unbound hormones ready to be utilized by your body. That's a key component that we have to focus on. It's not bound by sex hormone binding globulins. So what we do by testing you on day 18, 19, 20, 21 of your cycle, we can define not a disease state, because we're not medical doctors, we're naturopaths, we're clinical nutritionists. We can define imbalances and deal with you more on a rebalancing scenario. So number 1, a saliva hormone panel to define, do you have excess estrogen, do you have excess testosterone, do you have deficient progesterone, or all of the above? What do you have? The other part that I think plays key here is nutrient deficits. Many times women have a lot of nutrient deficits here. Many times they're the family of the Bs. They are low magnesium status, as mentioned. So there's a lot of nutrient issues that go along here. Sometimes low thyroid. And I don't know that I would approach that. I'm just throwing out all the potential problems. I don't know that I would approach an individual right out of the box with a low thyroid. We would be looking more specifically at hormones, nutrients, liver congestion. But thyroid has to be played. Liver congestion plays a huge role here. How we eat, not enough antioxidants, not enough core micronutrients in your diet, not enough fiber, too much white and refined. It's not a disease state. It's not damage to your liver, but your liver becomes congested just with the issues of life. Why is that important? Because you process your hormones. That's a final point of disposition of your hormones. So if I'm deficient in nutrients, I'm overwhelmed, I don't have good bacteria in my gastrointestinal tract, there's a specific reason. The enzyme's called beta-glucuronidase. You'll recircle these estrogen metabolites. We don't want to do that. That'll add insult to injury. If I don't have adequate fiber to sequester and move these estrogen metabolites, this sounds like a lot of technical information, but just keep it simple. My diet can play a role. Nutrient deficits can play a role. I can be hormonally imbalanced, which can be fixed without having to use serotonin reuptake inhibitors, pharmaceuticals, or necessarily oral contraceptives. Stress plays a huge role here as well. Stress plays a huge role, especially with PMDD. High stress hormones allows for, or should I say, causes you not to be able to make some of your brain neurotransmitters efficiently. Serotonin levels drop, and why you're more prone to depression during these periods. There's a lot of other issues that I want to talk about today. Prolactin plays an issue here as well. I think that's a little too much for what we want to try to deal with. Do I believe there are natural approaches to dealing with PMS, everything from cramping, excessive heavy menses, anxiety, mood disorders, etc., prior to, without using some type of pharmaceutical intervention? And the answer is without question, yes. Diet, get you on a core base of nutrients, many times coenzyme form of Bs, the right forms of magnesium, a fully ionized, fully bioavailable source, and that dose should be titrated or adjusted to your specific needs. Do an evaluation of the saliva hormone to find out where we could intervene and help you along those lines. Do some liver support. Many women need to have their liver supported during these periods, and that doesn't mean forever, but many times even just for a few months, a period of time, to help with liver processing. Good bacteria in the stomach, raise your fiber intake, and then utilize some specific nutrients. There are some specific nutrients. We use a German standardized form of Agnus castus of chasteberry that is a wonderful hormone balancer for women. So once again, looking at how do we rebalance you, attempting to define it using saliva hormone panels, using specific micronutrients, understanding the role of the liver, understanding the role of gastrointestinal health and integrity. Well, that sounds like that's way too complicated, the gastrointestinal. No. Adequate sources of fiber, reduce certain foods in your diet, use good forms and the right forms of human strain probiotics that are live and viable at the time of use. Many products are not. And that's kind of where I believe that we come in and we enter into this process as well. So I believe that there's a strata, a hierarchy of how you can deal with this if you're patient. Otherwise, you will be battling everything from breast tenderness, anxiety, mood disorders, depression. Your life is in disarray many times. To a degree, will you always have something along these lines? I think that's reasonable. Unfortunately, many women and many young girls, young women, 15, 16, are battling with excessive issues. And I believe many times are having to resort to pharmaceuticals when maybe that's not necessary. Hey, you can get more information at lenandjoe.com. You can go to that website. You can tune into our radio broadcast Monday through Saturday. We broadcast 6 days live. You can go also to the website at mscompounding.com and talk, or look rather, at some of the points that we have there. Once again, about hormones, about saliva testing, how they interact. There's a tremendous amount of information in that site that you can just tab right onto that we have provided for you. lenandjoe.com, mscompounding.com. See you again.